Good morning, everyone. I'm just going to do a quick discussion stroke run through about the RCGP portfolio, which is a very important aspect of the GP training in the UK. Just as a form of introduction, the GP training, to become a GP in the UK, you have to meet three aspects to the end. You have to pass your first exams, which is called the Applied Knowledge Test. You have to do the SCA, and then you also need to pass your portfolio. So the portfolio is a very important part, and if you pass all your exams and you don't pass your portfolio, it can give you an extension, it can give you problems even from the beginning of training. So it's always important that you are on top of your portfolio from the word go. But before we go into the portfolio, let's talk about the basics first. When you come into training in the UK, you have to have your portfolio set up. So, for example, if you've gotten a training post, which I believe everyone here has gotten, you will get an email from RCGP. RCGP is Royal College of General Practitioners, telling you to register for your portfolio. I have seen questions in different groups saying, must we register for the portfolio? Must we pay this amount of money? The thing is that until you pay and register for the RCGP, you would not have access to your portfolio. So it's something that you need to do before you start training. And if you check your emails, if you're starting training in August, by about now, you should have received an email that will be tucked in somewhere telling you to pay for your portfolio. Usually, every payment is taken at the beginning of the tax year, which is in April. So what it means is that if you start your training in August, they would charge you from August till April the following year, if that makes sense. But if you start training in February, you'll be charged for just February, March, April. So you might see a case whereby someone that starts in August pays a higher amount than someone that starts in February. So the summary of just this introduction is to tell you that to get your portfolio set up, you have to pay an amount of money. You cannot delay it. Until you pay, you will not have access to your portfolio. So that settles how to access your portfolio, which is important for GP training. So moving on to what happens in the portfolio now. Before you start training, you would have gotten some information about who is your educational supervisor. An educational supervisor is the person that supervises your training for the whole 3 years or however long you do your training. So he or she is the one that will guide you throughout the whole training, and it's someone that you will be in contact with, that you have communications with, that you have your reviews with. That is different from a clinical supervisor. I'm sure by now you would have received your rotations. Clinical supervisors are the ones that oversee your progress per rotation, while educational supervisors are the people that go through the whole duration of your training for you. Why I had to mention this is that once you have access to your portfolio and you have the name of your educational supervisor, it's good practice and it shows that you are on top of your training if you send an email to your educational supervisor. This is what I did. For context, I started training also straight from my home country, and immediately I got the name of my educational supervisor. I sent an email introducing myself, a quick story about my background. This also keeps you on a good footing, and it tells them that you're here to train and you're here to know what you need to do. So you establish contact with your educational supervisor, and then for the post you're going to start, you establish contact with your clinical supervisor. This is good. It gives them a good picture of the kind of person you are. I've had experiences where I've had colleagues who did not establish contact with their supervisors up to 2 months into the training program, and it's not a good way to start training. Why I mentioned it is because coming back to the portfolio, when you establish this contact with your educational supervisor, best practice, what they would usually do is to fix a meeting with you. So just to discuss your expectations for the training and things like that. And the details of this meeting would usually be entered into your portfolio. That is why you need to have access to your portfolio. And then you would also have a meeting with your clinical supervisor who is in that the post you're doing. For example, if your first post is like maybe geriatrics or care of the elderly, you're going to have a meeting with your clinical supervisor. This is called a placement planning meeting. If you open it, you would have a meeting with your clinical supervisor, and there, when you finish having that meeting, most of these clinical supervisors, they've been clinical supervisors for a while, so they know what to do. So as you can see here, it says trainees must arrange and document a placement planning meeting at the start of each new placement. So that means this is postgraduate training. So it behoves on you to contact your clinical supervisor and arrange and document a meeting at the start of each new post. So it's not a case of you waiting for them. Now, there have been situations where some trainees do not know their clinical supervisor. So it also behoves on you to find out from the rota coordinator of your posting who is your clinical supervisor and establish contact with them. So most times this meeting, the idea is to set your plan for that post, if that makes sense. So as you can see, when you finish having the meeting, you would have your discussions, and then you as a trainee would now go to your portfolio, click on placement planning meeting as I had clicked on, click on new placement planning meeting entry and put a title. Most times the title could be placement planning meeting for care of the elderly rotation. Any title is fine. Then you can now scroll down, and then it's usually in bullet points. So you just put the date, talk about the main areas discussed, talk about the learning opportunities, the objectives you agreed on. You just do that. You just write it up as it is, just exactly what was discussed. Recently, I noticed that for in my own case, my supervisors, when I had these meetings with them, was usually virtual, and they would record it. So even if you write all these things, most times they will compare what you've written with what was recorded, if that makes sense. So when you do that, most times it's a placement planning meeting. So there's no file to be attached, and then you just save it. Now, there are other aspects of the portfolio which I would have to mention here, but this settles your placement planning meeting, if that makes sense. Now, so we have clinical experience groups. So as you can see, ignore the entries there and just look at the clinical experience groups. So we have all these. We have infants and children, we have gender, we have people with long-term conditions, older adults, mental health. All these are the clinical experience groups. Then we have capabilities, which I came here because I need to mention it in the placement planning meeting. So we can see capabilities. We've got fitness to practice. Now, what I would advise is when you have your portfolio, it's good to have a read through of the capabilities and what kind of things fit into your capabilities. Why I had to digress from the placement planning meeting I was talking about is because every entry you put in your portfolio, you have to map it to a clinical experience group and a capability, if that makes sense. So the more you map, the better. So for capabilities, fitness to practice is like anything that makes you work better as a doctor. So, for example, for myself, when I started training, I had some challenges because I came directly from my home country. I had some challenges with understanding the way people communicate in the UK and things like that. So, for me, I felt it was a fitness to practice thing. So, when I wrote my placement planning meeting, one of the things I discussed with my clinical supervisor was I want to learn how I feel this might be a challenge for me to treat patients here. So I want to understand how they communicate, how I can treat them better. So for me, I mapped it to fitness to practice, if that makes sense. Because I felt if I do this, if I learn how to communicate better, I'm able to treat patients well, and then I'm able to practice better. I don't know if that makes sense. So the point I'm trying to make is that you need to have a study of what's happening here. Let's look at an ethical approach. It's how did you manage this patient ethically, if that makes sense. Communication and consulting, that what I mentioned about communication can also fall in here. Okay, so the point I'm trying to make is that you need to have these capabilities at your fingertips to know what to map. So going back to, if we go there, you can see what they wrote here. They said, if you look at the first line, they said training must arrange and document a placement planning meeting at the start of each new post. This allows for a record of placement planning meetings, which are now mandatory. It links to working with colleagues and in teams, fitness to practice, and organization management and learning. That is why I had to go and talk about capabilities. So they have said this is what it could link to. So what it means is that you need to link it to something. You mustn't link it to these ones, but depending on what you've discussed with your clinical supervisor and the areas you think you need to work on in that rotation, when you're writing it up, when you finish writing up all you need to write and you save, let's just do something dummy. If you save, you can now see that if you save, because I've not written anything here, nothing will come up. But if you save, it takes you to another page where you need to put your capabilities and your clinical experience groups. So I don't know if that makes sense, But for placement planning meeting, you have your meeting with your clinical supervisor, you talk about the main areas discussed, everything, and then you now go and map it to your capabilities. I hope that helps. So